Welcome to New Start at Home. I'm Dr. David DeRose. Today we're speaking about a problem that's very common in medical offices. It's likely that you or one of your loved ones have experienced it. The topic is frozen shoulder. And with me is Jerry Flores. Jerry is a therapist at Weimar Center of Health and Education, part of the NEWSTART program. Jerry, do you see a lot of problems with frozen shoulder?
Yes, I do. As a matter of fact, that's one that comes in frequently. And we do treat it. The medical term is adhesive capsulitis. And the word adhesive means that things just are like glued there. They tighten up, they atrophy, and I'm going to give one example. For example, let's say you break your arm, you get in a cast. They cast it. 2 months later, your broken bone is healed, but you didn't use your shoulder joint at all, or very little, and then you get up to this to put on a shirt, and all of a sudden, ouch, you can't go above there, and you got excruciating pain.
Okay, so you're not, a frozen shoulder doesn't mean necessarily that they just can't move their shoulder at all. They've just got severely limited range of motion.
Yes, limited range of motion. Usually, they could go up to about 60 to 90 degrees, but they can't go up above that, the full 180 degrees, all the way up to your ear.
Okay. So Jerry, from our experience, it's very likely that many of the folks tuning in today either have some shoulder limitations or they know someone who does. What can you do to help them? What can they do at home to get some help?
Right. Well, the first thing that I like to do is it's a frozen shoulder, right? So I just like to thaw it.
Okay,
you know?
fair enough.
And then
out the frozen
you thaw
shoulder.
out the frozen shoulder. So you just apply some heat, a hot pack. You take an Epsom salt bath, which is very good. We know it relaxes muscles, and that helps. But then the key to helping a frozen shoulder is that you got to use a simple formula. For a comfort scale. Okay. What I do is I teach people how to use colors: red, yellow, and green.
Just like a stoplight.
Just like a stoplight, or green, yellow, and red. Green, no discomfort at all.
Keep going.
Keep going, yes. Yellow, warning, but it's still okay to go. And in this case, it would be move. And red, which means stop, too much discomfort. Therefore, you don't continue with the stretch or with the pressure. So when you got a frozen shoulder and you go up here and it's okay, it's green. But you raise it up, gets yellow, and then just a little bit more and it gets into the red zone. That's where people don't know what to do. That's when we apply the heat and then just stretch it out a little bit more. And if you like, we could demonstrate a little bit on you.
Oh, sure.
Sure? Yeah. Okay. So I'm going to take Dr. DeRose's shoulder, and let's say it was frozen, and you tell me, I'm going to raise it up, and you tell me as soon as it feels uncomfortable.
Am I supposed to make believe I got a bad shoulder?
Yes. Okay, right there. We can't go past that range of motion, right? Assuming we already applied the heat, right? We got more blood flowing there, more oxygen, water, and nutrients. So then what I do is I start, of course, you're lying down on a table, right? And what I do is I start just moving it just a little bit, and I don't go past the yellow. But then I do something.
Okay, what do you do?
I stretch it out, and I let the arm relax, and I go. And I pull on the shoulder. Okay, on the shoulder joint like this.
And if I were laying down, I wouldn't be moving so much.
Exactly.
My weight would keep me there.
So then that's going to loosen up all the tendons, ligaments, and muscles, and that's going to allow for a further range of motion. Okay, we're there. We got about a degree or two, just a little bit more. So then what I do is I like to push the joint in and rotate it. And that breaks up a little bit of the scar tissue that has built up, and it allows it to gain a little bit more mobility. So once I'm doing that, I'm done with doing that, I'm able to go and just stretch it a little bit more, and it stretches a little bit more until after about an hour and a half of therapy, in most cases, I'm able to get about 160 and sometimes even 180 degrees in just one therapy. But usually it takes about 2 or 3 therapies to solve this issue.
And so presumably people can do this at home, working on one another.
Yes.
Listen, I hope you found some very practical information on today's edition of New Start at Home. If you want more information, simply go to NewStartClub.com.